World Rabies Day is an international awareness campaign coordinated by the Global Alliance for Rabies Control, a non-profit organization with headquarters in the United States. It is a United Nations observance and has been endorsed by international human and veterinary health organizations such as the World Health Organization, Pan American Health Organization, the World Organization for Animal Health, and the US Centers for Disease Control and Prevention. World Rabies Day takes place each year on September 28, the anniversary of the death of Louis Pasteur. With the collaboration of his colleagues, developed the first efficacious rabies vaccine. World Rabies Day aims to raise awareness about the impact of rabies on humans and animals, provide information and advice on how to prevent the disease in at-risk communities, and support advocacy for increased efforts in rabies control. Rabies remains a significant health problem in many countries of the world. Over 99% of all human deaths caused by rabid dog bites happen in the developing world, with 95% of deaths occurring in Africa and Asia. With the exception of Antarctica, people and animals on every continent are at risk of contracting rabies. One major problem with rabies prevention is the lack of basic life-saving knowledge among people at risk. Organizations working on the issue can often feel isolated, and as a neglected disease, rabies does not attract sufficient resources even though the world has the tools and knowledge to prevent rabies, and nobody needs to die from this disease. Health awareness days can help to improve policy on diseases and increase resources to prevent and control them. This understanding led to the development of an awareness day against rabies. What is a rabies virus? Rabies virus actually belongs to the family Rhabdoviridae. Rhabdoviridae itself has two important genera. One is the Lyssa virus and the second one is the vesiculovirus. The Lyssa virus has 7 serotypes, in which the serotype 1 is responsible for the rabies virus. Rabies virus is a bullet-shaped, 180 nanometer long, enveloped virus, which means susceptible to lipid solvents like ether. It has a helical symmetry and it is a negative single-stranded unsegmented RNA genome. The RNA genome itself encodes 3 structural proteins N, M and G and 2 non-structural proteins L and P. Coming to the pathogenesis of rabies disease, when there is a viral entry, inside the muscle there is a local multiplication happening. And there in turn it goes to the NMJ, that's the neuromuscular junction, which results in retrograde axonal transport at the rate of 3 mm per hour, and which results in the multiplication in the spinal cord, which goes to the brain. Also there it causes multiplication. And the important highlighted feature of rabies disease is the centrifugal spread via the peripheral nerves. And after multiplication in the brain, there occurs a centrifugal spread via the peripheral nerves, which results in the manifestations happening in the skin, cornea, salivary gland, pancreas and kidneys. And the highlighted feature, the pathological feature what leads to the diagnosis, is the appearance of Negri bodies. The highlighted pathological feature of rabies disease is Negri bodies, which is around 1 to 7 micrometer. The inclusion bodies of rabies virus seen only on brain biopsy. On H&E stain, cytoplasmic eosinophilic inclusion bodies with basophilic granules can be seen. Most common site is the hippocampus. Hippocampus, after that cerebellum, then there is cerebral cortex and even brainstem. So the hippocampus is the highlighted area where we can see more of Negri bodies present. Coming to the clinical manifestations, only 15% of cases develop rabies. Multiple bites and bites on the face increases the risk of infection. And there are different stages for rabies disease. The first one is the incubation period. The incubation period is actually the duration is 1 to 2 months. The next stage comes the prodrome and early symptoms. The symptoms such as fever, nausea, vomiting, anxiety, headache, paresthesia or even pain at site can be seen in the duration 2 to 10 days. So 2 to 10 days is the prodrome and early symptom stage. The next stage is the common thing where you can see 80% of cases can be seen. The stage known as acute neurologic disease or furious rabies or encephalitic. So 80% of cases are encephalitic. The duration is 2 to 7 days. The symptoms you can see what we see in, for example, in TV films, what we have mainly heard of is the hydrophobia. Hydrophobia is the highlighted clinical finding you can see. It's a pathognomic in this particular stage known as encephalitic stage or acute neurologic disease stage or furious rabies. Along with hydrophobia, you can see aerophobia, bizarre behaviors, anxiety, agitated. The person is agitated. There is a hallucinations present. Also, you can see autonomic nervous system manifestations like hypersalivation, sweating, pupillary dilatation, etc. Next stage comes the paralytic or dumb rabies. That is a 20% of cases you can see is a paralytic or dumb rabies stage. The duration is again 2 to 7 days. The clinical findings you can see is ascending flaccid paralysis. And the last stage is the coma or inevitable death. The stage of coma or even it can go to death. It is around the duration of 14 days. The clinical findings invariably fatal encephalomyelitis. Means it can even lead to coma and death. So encephalomyelitis, fatally it can be seen in this particular stage. Now how to diagnose rabies? Ante-mortem and post-mortem findings are different. I mean, there is a difference in the ante-mortem and post-mortem. Still, some common things are there. So, ante-mortem, the best diagnostic tool you can see is skin biopsy. The nape of the neck just above hairline, including 10 hair follicles, can be taken. So, the best is skin biopsy. The corneal impression smears can be done. The saliva can be tested. Like, for example, IF for antigen detection. The most common used is IF for antigen detection. RT-PCR can be done, which accounts of more than 95% sensitive and 100% specific. Corneal impression is actually no longer used. When you study in textbooks, corneal impression can be done. Corneal impression smears are taken as ante-mortem diagnosis, but nowadays it's no longer used, you can say. Corneal impression is no longer used, but preferred one is the CSF, saliva, skin biopsy. Skin biopsy is the best, whereas post-mortem, brain biopsy and RT-PCR, culture test, IF for antigen which comes in the saliva also can be done. And Negri bodies can be demonstrated in brain biopsy only. So the brain biopsy is the only thing which I think it is the ideal thing you can tell for post-mortem diagnosis of rabies virus. So Negri bodies can be demonstrated only in brain biopsy. So brain biopsy is the one you can remember in post-mortem diagnosis of rabies virus. Ante-mortem you can say CSF, saliva, skin biopsies preferable, whereas corneal impression is no longer used. Coming to the treatment of rabies disease, there is no treatment. It is invariably fatal. Death occurs within 1 to 2 weeks. That's earlier I told you approximately 14 days is the duration when it reaches the coma stage. Definitely preventable even after infection. Wound treatment can be done. Copiously washed with water along with antiseptics for 15 minutes. Never suture. When there is a dog bite, a patient comes to you in the casualty as a doctor. Never suture, never close the wound. Thoroughly you wash with water and with antiseptics for 15 minutes and keep it open. Don't immediately suture the wound. It can lead to an infection again. Then RIG, rabies immunoglobulin. PEP, pre-exposure prophylaxis can be given. A vaccine which is a killed fixed rabies virus grown in cell lines. And the vaccines, there are cell lines vaccines you can give is SDCV, which is human diploid cell vaccine. PCEV, purified chick embryo cell vaccine. And PCEV again, purified vero cell derived vaccine. So there are 3 cell lines of vaccines: human diploid cell vaccine, purified chick embryo cell vaccine, purified vero cell derived vaccine. Again, rabies virus can be even street rabies virus or fixed rabies virus. Street rabies virus means it's isolated from lab animals, infective via several routes. The incubation is 1 to 12 weeks. Negri body is highly present, not used in vaccines. The fixed rabies virus, whereas it is a serial passage in lab animals like rabbits, infective only via the intracerebral route. The incubation is around 1 week. Negri bodies is present but not compared to the street rabies virus. It is less common, but it is also present. You can say when you compare, you can give 1 positive finding, 1 plus for fixed rabies virus, whereas there is a 3 plus higher chances of Negri bodies diagnosis you can see in street rabies virus. So as I earlier told you, the rabies vaccine is the thing which you can give for a person who has got a dog bite or even cat bite. Any animal bites, you are supposed to take a rabies vaccine nowadays. So if you have not been vaccinated against rabies in the past, you need 4 doses of rabies vaccine over 2 weeks, given on days 0, 3, 7 and 14. You should also get another medication called rabies immunoglobulin on the day you receive the first dose of rabies vaccine or soon afterwards. If you have received rabies vaccination in the past, you typically need only 2 doses of rabies vaccine after an exposure, that is 0 and 7 days. So there's a difference between those who are not vaccinated and those who are vaccinated. Those who are not vaccinated, there is a requirement of 4 doses, 0, 3, 7 and 14. And nowadays IDRV is there, intradermal route rabies vaccination is there. So that is 0, 3, 7 and 28. So that is given intradermal, but intramuscular is 0, 3, 7 and 14. So freshly exposed, the first time you are getting a dog bite, a cat bite or animal bite, you have to take 4 doses over 2 weeks, 0, 3, 7 and 14. Or 0, 3, 7 and 28 intradermally, whereas you are vaccinated in the past, you have to take typically 2 doses, 0 and 7. So rabies vaccine may be given at the same time as other vaccines. That can also be done. So even the dogs can be taken the rabies vaccines. The cats, any animals in your pets can be given immunization with the rabies vaccine. So you can use to prevent the rabies. If you are knowing the disease, if you're knowing about rabies, if there is awareness day, that's why the awareness day is created today, especially September 28 is created. On every year it is celebrated as World Rabies Day to raise the awareness regarding the disease known as rabies and how to prevent it and what are the causes. That's why I am highlighting today as a video. I am doing a video on World Rabies Day. I have told about the pathogenesis, the clinical manifestations, the treatment mode, the prevention. So ideally, let everyone be vaccinated with who's having a pets. All the pets be vaccinated, whether it's a dog or a cat. Let it be vaccinated. And if you have exposed to a particular dog bite or animal bite, let it can be taken rabies vaccine. Therefore, it can help in everyone avoiding or preventing the disease known as rabies disease. That is our ideal aim on this particular day. Thank you.